Welcome friends to this PowerPoint presentation about exercise is medicine. My name is Matthew Ellis. Now the purpose of this presentation is to demonstrate how exercise and physical activity prevents chronic disease and to demonstrate how exercise and physical activity help to manage and treat chronic disease. Now let's go through some definitions important to this slideshow. So exercise, a structured or planned physical activity that has a purpose to increase physical fitness, such as going to the gym, swimming, cycling, walking, or gardening. Inactivity-induced chronic disease, a disease that is long-term in nature caused by inactivity. And physical activity, any movement required by the body that makes your heart beat faster. So, exercise as medicine. The way we engage in daily activities has changed dramatically since the Industrial Revolution. Advancements to science and engineering is making our lives increasingly less labour demanding. As a result, inactivity-induced chronic diseases have been escalating in Australia and at an alarming rate and are now a leading public health issue. A smorgasbord of research exists which supports the need for exercise as medicine to prevent chronic disease. A 2012 meta-analysis provides conclusive evidence that physical inactivity primarily causes a deterioration of functional capacity and chronic disease. The following findings are explained. Physical inactivity is a primary cause of 35 chronic conditions, including metabolic syndrome, obesity, insulin resistance, prediabetes, type 2 diabetes mellitus, cardiovascular diseases, bone and connective tissue disorders, cancer, diseases of the digestive tract, pulmonary and kidney disease. 80 studies of monozygotic twins provide indisputable evidence that physical inactivity increases the risk of chronic disease. Physical activity has a strong inverse relationship to all-cause mortality, and physical activity can be used as a clinical strategy to prevent and treat inactivity-induced chronic diseases. Endurance and strength are required to reduce the onset of frailty. Maintaining a high level of VO2 max is a primary preventer of mortality and morbidity. So, what is the impact of inactivity-induced chronic disease for Australians? More than 55% of adults aged between 18 to 64 years do not participate in the weekly recommended physical activity. 2.5% of the total burden of disease was due to insufficient physical activity. The main diseases represented were 31.2% for uterine, bowel and breast cancer combined, 25.2% for coronary heart disease and stroke combined, 20% for type 2 diabetes mellitus, and 12% for dementia. So, how's Australia preventing inactivity-induced chronic disease? Well, the government has responded to the existing public health crisis through the integration of the National Preventive Health Strategy and the National Strategic Framework for Chronic Conditions. In 2021, the Commonwealth Department of Health and Aged Care released the National Preventive Health Strategy 2021 to 2030 to address chronic disease, health inequity, and other health threats. Prevention requires measures to avoid the onset of illness, disease, and injury, with the goal to maintain and improve the health and well-being of the population. So these types of preventive measures are primordial prevention, focusing on the wider determinants of health factors that negatively impact health. Primary prevention, focusing on the risk factors to prevent a disease or disorder, such as a vaccine program, health information, or consultations from a health professional at a personal and community level. There is also secondary prevention, focusing on interventions to manage an existing condition and prevent further severity, such as screening programs for early detection of diseases or a drug therapy to prevent further disease progression. Finally, tertiary prevention, focusing on the treatment of a health condition that already presents in order to limit or reduce the condition. For example, rehabilitation, surgery, or adopting strategies that support an individual to lead a better quality of life. So, primary prevention and the evidence-based physical activity guidelines. Now, the development of the Australian Evidence-Based Physical Activity Guidelines enables medical and health professionals to prescribe appropriate exercise interventions to prevent inactivity-induced chronic disease. In 2012, the Australian Government Department of Health and Aged Care reviewed the Evidence-Based Physical Activity Guidelines requirements as research was becoming outdated and did not include changes to the increasing levels of sedentary behaviour throughout society. The Department of Health and Aged Care released its draft report in August 2012 with the following recommendations for adults between 18 and 64. So minimise sitting time, undertake 30 to 60 minutes of moderate intensity physical activity or 15 to 30 minutes of vigorous intensity activity on most days, if not all days of the week, or a mixture of both. For extra health benefits or for the prevention of weight gain or some cancers, participate in 60 minutes of moderate activity on most, if not all days of the week. Doing any physical activity is better than none. Build up to these recommendations and participate in resistance training on 2 days per week. The Department of Health and Aged Care also reviewed and released the following physical activity guidelines: evidence-based physical activity guidelines for pregnant women, movement, sedentary and sleep guidelines for children and young people, and physical activity guidelines for older adults. So let's have a look at the evidence-based physical activity guidelines in practice. So for example, sitting time. Having a break for a few minutes every half hour with some light exercises. Cardiovascular exercise. Undertake moderate intensity exercise at 55 to 70% of your maximum heart rate. These exercises can include gentle swimming, social tennis, gardening, a brisk walk, or cycling at a regular pace. Vigorous intensity exercise may include jogging, cycling fast, aerobic classes, and competitive tennis. With vigorous intensity exercise, a compensation cannot be maintained through the activity when sustaining your heart rate above 70% of your maximum heart rate. And vigorous intensity exercise amounts to double the amount of time compared to the moderate intensity exercise. And finally, resistance training or strength training. A reasonable starting goal is to undertake 3 sets of 8 to 12 repetitions of a variety of functional exercises on at least 2 days per week. Now let's look at secondary prevention and metabolic syndrome, cardiovascular disease, type 2 diabetes mellitus, and cancer. So what is metabolic syndrome? Well, metabolic syndrome is a chronic condition and occurs when an individual has 3 or more out of 5 risk factors that increases the likelihood of cardiovascular disease and type 2 diabetes mellitus. What is the prevalence in Australia? Over 35% of Australians have metabolic syndrome. It's quite a lot. What are the symptoms? Risk factors include a large waist circumference, high blood pressure, high blood triglycerides, low levels of HDH cholesterol, and insulin resistance. And what are the causes? Overweight, being obese, and being inactive. So let's look at the secondary treatment or secondary prevention treatment for type 2 diabetes mellitus. There is an abundant amount of high-level evidence, including systematic reviews and randomized controlled trials, demonstrating that lifestyle modifications, including physical exercise and diet, can prevent or delay type 2 diabetes mellitus. Physical activity reduces blood glucose, lipids, cholesterol, and blood pressure. Cardiovascular disease and secondary prevention. A 2012 meta-analysis of 21 studies between 1980 and 2010 with a sample size of 650,000 participants found high levels of physical activity reduces the risk of coronary heart disease by 20 to 30% and stroke by 10 to 20%. That's quite significant. And secondary prevention of cancer. A 2011 longitudinal study with a sample size of 33,230 participants found 56% had a higher risk of cancer mortality associated with metabolic syndrome after 14 years. A meta-analysis of 1.44 million adults across Europe and the US found physical activity decreases the risk of up to 13 types of cancer. Furthermore, the Cancer Council recommends aiming for 300 minutes of moderate exercise or 150 minutes of vigorous exercise to prevent cancer. Okay, let's look at tertiary prevention and treatment for type 2 diabetes mellitus. Australian clinical guidelines for the management of type 2 diabetes mellitus states that physical activity and diet are effective in managing the condition. Diabetes Australia recommends adults follow the physical activity guidelines for cardiovascular and resistance training and reduce sedentary behaviour. Cardiovascular disease. So Australian clinical guidelines for the management of heart failure provide strong evidence for the use of physical activity for patients with stable chronic heart failure. Moderate intensity cardiovascular exercise decreases hospitalisation, increases physical function, and improves quality of life. And finally, let's look at cancer. Exercise as a form of treatment for cancer patients is not included in Australian clinical practice guidelines. However, physical activity is supported by the National Cancer Institute clinical guidelines in the United States, drawing attention to recent research indicating a longer survival rate for patients with breast cancer. Okay, thank you everyone for attending this presentation. I hope you enjoyed it and gathered some useful information that will benefit your quality of life.